Hi, everyone. Today, I had the pleasure of introducing Tam Trinh, who is a rising junior at UC Davis. Tam works as a pharmacy technician where her passion for medication shines. A fun fact about Tam is that she has a nail tech license and likes to create nail art designs as a stress reliever. Take it away.
Hello, everyone. This summer, I have an honor to work with a clinical research pharmacy manager at UCSF Benioff Children's Hospital, Dr. Kimberly Leong, and her team to investigate the impact of Pyxis automated dispensing cabinet on control medication in the inpatient hospital setting. And this project was supported in part by a grant from HSI STEM grant. Let's dive into the background of the system. So what is an auto dispensing cabinet, or in short, ADC? It is a decentralized medication distribution system that provides computer control storage, dispensing, and tracking of drug at the point of care in inpatient care unit. Pyxis ADC include two main machines, Pyxis MedStation ES, which is the picture on the left, and Pyxis C2C, which is the one on the right. At Benioff Children's Hospital in Oakland, we have 13 MedStation ES throughout 13 different unit, and one Pyxis C2 safe inside the pharmacy to store, track, and monitor the control meds inventory within the hospital. Together, the technology virtually eliminate time-consuming and error-prone manual record keeping. Moving to my next slide, what is the mechanisms of this system and how did I conduct this study? Every day, 24/7, Pyxis MedStation ES will keep a record of all the control medication transaction that have been done within the department and send it to the C2 safe, which will auto print out in pharmacy office every morning. My job this summer is to review all the discrepancy from June 15th to July 31st, sorted out those that had not been resolved and find out why. I then take those data and compare it to our old system, which is AkiDose. There will be three different discrepancies that I will analyze today. One is missed dose, missed wage, which is when the amount of control medication giving or wasted by the nurse staff does not match the doctor order. Second, miscal, mistype is when the amount of control medication in Pyxis MedStation does not match with pharmacy inventory. And last one, misorder is when control medication is removed without the doctor order. So what is the result? Is the new system improved or worse the workflow? In my first graph, it will show the result of total missed dose, missed waste in different departments. Throughout my result graph, I was used the blue tone bar for AkiDose, which is the old system, and the green tone bar for Pyxis. The results show that within 2 weeks of transition, I apologize. Missed-dose, missed-weight discrepancy reduced by 45%. Even when we're looking at the data for the whole month, July discrepancy still reduced by 28% compared to May. As you can see, the only 3 departments left with missed-dose, missed-weight discrepancy are post-anesthesia care units in outpatient clinic, which is PACU OPC, operation room, OR, and emergency department ED. Even with ED, which is have the highest discrepancy before, remarkably reduced by 89% one Pyxis goes live. My next result graph showed the total misorder discrepancy in different departments. Once again, within 2 weeks of transition, the misorder discrepancy decreased by 88% compared to the old system, and ED limits 85% of total misdose discrepancy within 1.5 months. Last result graph I have for the study showcase miscal, mistype discrepancy. In order to equally compare, we can looking at data of July and May. Pyxis has significantly reduced miscal, mistype by 37% compared to AkiDose system. Furthermore, 90% of the data on July are mistyped due to the new display of the system. I strongly believe once our staff get used to the new system, this number will drop even more. In conclusion, 10 out of 13 departments have crucially decreased 95% of total discrepancy within 1.5 months. ED itself also lowered their discrepancy significantly. And one point I want to let you guys know is about the 3 departments that still have the discrepancy, which is PACU, OR, and ED. This is due to the fact that Benioff Children's Hospital is a level 1 pediatric hospital, which receive the high volume of emergency trauma seizure case every day. Those cases require control medication within 15 minutes. Therefore, nurse staff has to override the Pyxis Med Station ES and create purposely discrepancy. I want to express my appreciations to CSE program, Corey, UCSF Benioff Children's Hospital, and all my mentors that support me along the way. Thank you for listening to my presentations, and feel free to ask questions.
Fantastic, Tam. Really interesting. I'm glad you were able to get access to this data to look at it so carefully. Charles, you got the first question.
Hi, Tim. It was great to see your presentation after being in your group all year. So it was really nice seeing it come together. And I just want to know, so as an aspiring pharmacist who now has had considerable time like working in the pharmacy, what do you think are the next steps as far as like automation, like to streamline the process in the pharmacy profession, specifically like clinically?
Thank you. Thank you. For myself, I believe this machine and this system is actually the next step already, because it just get put to use a month and a half, exactly the time that we start. And I do really looking forward to have like a big impact on our discrepancy, and hopefully that the purpose of the machine is to limit down the error that our nurse, our staff, and because we limit the error, our pharmacy will not have to trace this back and look at why that there is an error on those. And therefore the pharmacy workflow will be improved. If ever in the future, I hope I can see that if we can create any other way that helps specifically to like emergency case, like ED or PACU, that is just one of the point that I think if we ever have or invent a technique or a machine in the future, though is the key point to answer the question.
Thank you.
Thank you.
Tanisa?
Thank you, Ellen. Awesome job, Tam. I mean, it's been so much fun to see you like blossom for the second year. I was curious, like from your point of view, if there's like anything this, like being part of Corey this year has taught you about yourself that maybe you didn't even know or expect.
One of the point that I really appreciate that this summer that I learned is I able to shadow and to have a taste of what is inpatient pharmacy and pharmacists be like, what is the role, what's the responsibility, and how is the workflow in the hospital. Even though I do work as a pharmacy tech outside, I wasn't able to have a taste of how's the hospital be like. And it's just like, it's so an honor for me to able to shadow like a level 1 hospital. So the workflow is different, and how the responsibility of the pharmacist also able to work with the team is very important in order to like roll it fast and accurate for every case, especially when we have like a code or an emergency case. That is very super important to have a teamwork that together can build and work like fast and accurate.
Excellent. Yeah, I had quite an education this summer, I think, between your project and CM's project and our speaker, Janelle, who was speaking about her experience in pharmacy school. So with all of the different potential opportunities that a pharmacist could work, do you feel like at the end of the summer you have a direction that you're leaning towards? Is it research? Is it inpatient? Is it outpatient? Or which direction you think you might go?
Totally. Thank you so much. I really appreciate the program because it's clear out my visions a lot. It made me realize that I do want to work like inpatient hospital.
Fantastic.
I won't lie that the hospital is hectic. The pharmacy is hectic. When there's a code, everyone will just go, and I nearly lost one time when I was able to shadow a code luckily. But I really like the hectic and like the adrenaline. So I do, if I was able to have more experience, because I know for now, even though I shadow, there's a lot of things that I wasn't able to understand. So if further down of my career, when I have enough knowledge, when I have enough of experience, I really hope that I can work like inpatient and like have interact more like clinical.
Excellent.
Thank you.
Tam.